Okay, so also the slides for this session, some of them are kind of dense. And so some of them are for your reference. We're not going to go through line by line everything on the slides, but they will be posted to the CT Boss website on the trainings page. And the CT Boss website has a ton of really great resources, including lots of trainings on there for you to look at, have on in the background if you're doing something different whenever you want to. And the recording will be posted for this within the next day or so. So you'll have that for reference if you want it. Okay, here's the agenda for today. We're going to go through an overview of Connecticut Balance of State Continuum of Care. We're going to look at the homeless response system in general, key partners within our specific COC, continuum of care, governance, system and project performance, the continuum of care competition, which is an annual process that takes place every year. Sometimes we refer to it as the NOFO, and resources. I wanted to say, like, oftentimes when we do this intro to our continuum of care, we might walk through some grant specific information for grant recipients or subrecipients. We're not doing that today. There are whole other trainings on that, and I think there's a link on another slide to those trainings. Yes. So what is a continuum of care? It's a group of people, right, coming together. Then they represent different sectors, different agencies, organizations to prevent and end homelessness. And you can't get HUD funding without a continuum of care. HUD requires every region that applies for funding to have a continuum of care. So some regions are really large, like Connecticut has only 2 continuums of care. The Balance of State, which is us, and then Fairfield County has its own. But Pennsylvania has a crazy, like, I don't know, maybe over 20, close to 30 continuums of care. Some are individual counties. So it's up to each region how they want to break that up. Um,
You know what I
the
wanted to say, which again, I know we're giving too much information, but I think it has to be just clarified. So we are called the balance of state. So if you think about that, it feels like we're like the leftovers. But the reason it's called balance of state is because back in the late 90s, there were areas in Connecticut that were not incorporated into other COCs. So once upon a time, Connecticut had 13 COCs, Hartford, New Haven, Norwich, New London, every area sort of had its own. And then slowly those cities would start grabbing in other areas. And then over time, so over the last 20 years, but probably was kind of 15 years, by 2015, we were probably set. We brought all of those COCs together, and the name still just stayed as balance of state. So it's kind of a misnomer because it doesn't really make sense. So we have the entire state minus Fairfield County. So just a little history.
Thank you. All right, so the continuum of care is designed to help people experiencing homelessness, individuals, families, youth, all populations experiencing homelessness, move into permanent housing as quickly as possible using the resources we have as efficiently as possible, right? We work to provide services needed to help people move into transitional permanent housing with the goal of long-term stability. And the program was designed to promote community-wide planning and strategic use of resources. Um, Improve coordination, integration with mainstream resources, healthcare, public benefits, those types of things. Other programs targeted to people experiencing homelessness, and to improve data collection and performance measurement to help us get a really good look at what we're doing with our resources, what kind of people are coming for services, what kind of people are having success versus challenges, and allow each community to tailor its program to the particular strengths and challenges within each community. We didn't say this in the beginning, but Liz did say we're easy. Like, feel free to raise your hand. Feel free to throw a question in the chat. So at whatever time you have questions, please feel free to interject. Other key responsibilities are identifying gaps in the system. So, for instance, what part of what we do is monitoring. And of course, through our meetings, we collect feedback also. And at some point in time, we learned that people were having issues, the number of people that needed Social Security benefits that were that had some kind of disability and needed to be connected with that benefit were not getting it. So we added SOAR resources, or we add different training resources, and for instance, for people to gain employment, or mental health, people to get mental health assistance. So those types of things. As you'll see later in the presentation, continuums of care have specific responsibilities required of them in order to achieve the goals of preventing and ending homelessness. So, monitoring that I just mentioned is one of those. Submitting materials in the annual continuum of care competition for funding, or the NOFO. Using the homeless management information system, which Russ mentioned earlier, HMIS, for data collection, and creating a coordinated entry system, which in our region we call the CAN, Coordinated Access Networks. Other key responsibilities are to help projects understand and follow federal and local requirements. HUD has a ton of requirements, as some of you may already know, and it's a lot to keep track of. And then on top of that, our COC has its own governance charter. We have our own policies and procedures, and that's a lot to keep track of. So it's our job to help people understand and follow the requirements. Um, Submit the annual point in time count. So that's a one time a year count that we just had in January. It's the end of January every year, mandated by HUD, that we need to collect data for and then submit to HUD. We just got an email this morning that that process is open. So it's due for us at the end of April. And then again, the reporting requirements that I mentioned already. So our particular funding, continuum of care funding, annually amounts to $75,305,000. The next slide is going to show you a breakout of that. In fact, I think I'll move straight to that. So here's a list of all the activities that that funds, and we're going to go into definitions of some of these: permanent supportive housing and those types of things in later slides. But the next slide, there we go. Shows you a breakout of each funding type, each component type, as HUD calls it. So permanent supportive housing, as you can see, is the bulk of our funding, and that's at $46 million. And I'll say it now, I may say it again. Permanent supportive housing is for people who have the highest level of need, who have a disabling condition, and who have been homeless the longest. And it, as the name says, it's not time limited. Once people are eligible and get into permanent supportive housing, there at this point in time is no time limit to the amount of time they can be in that program. Transitional housing was once disfavored by HUD, and now it seems to be more in favor. That's time limited to 2 years maximum, but less than our COC, and that's 645,000. Joint THRH is specific to DV programs. So that's a newer. We only have 3 programs of that. Street outreach was funded through a special NOFO process a few years back, and that's a little over $2 million of our inventory now. Where's rapid rehousing? And then rapid rehousing is also time limited, but that is more tenant based. People choose where they live, and it's designed for people to transfer in place. So they get their rapid rehousing unit. The idea is they get their unit, and then we transition along with them so that they can be self-sufficient in the same unit and move on to paying their own rent. in an ideal situation. So that's 22% of our inventory. And then you can see the other here. We do have a group of specific youth projects. So I'm going to talk a little bit about that later on. Currently, we have 114 grants in total, and a lot of those are broken up into different subparts, subrecipients, but that's how many grants we have right now. An overall view, actually, before I move on, somebody, SOAR resources. Melissa asked that SOAR resources for anyone seeking them and share info with your friends and neighbors. Melissa, is that a question? I'm not sure.
It's from a previous slide you were talking about. You just said the word SOAR resources. I wasn't sure if it was SOAR resources or SCORE resources.
SOAR. No, you're right. SOAR.
Okay.
So we added staffing to help people sign up and gain access to Social Security
Yep.
benefits.
I was just putting that in the chat for anybody who wasn't familiar with or didn't know what that was.
Thank
Thank you.
you.
Appreciate that. Overall use of the homeless response system. So right now, we use 211. It's a one-stop connection to local services, utility assistance, food, housing. Housing is among them, right? You go through 211 right now to access our CAN or coordinated entry system, coordinated access network. So each local region coordinates access to homeless assistance across the state. There's more information about that in at the link here about CAN. So 211 is a front door to a homeless service system. People call there to get help. It's run by United Way of Connecticut and it's funded by DOH. I think further on, I'm going to describe more what the CAN does, right? Yeah. These are the CAN regions throughout the state. Um, they're separated by county, and then you can see Fairfield County CAN, even though it's not our COC, they have their own CAN, and that's you can see on the map also. So, what is a CAN? What do they do? In 2009, Congress passed the Hearth Act, which significantly changed requirements for continuums of care. Among the changes was a new requirement that every continuum implemented a coordinated entry system, and our CAN system is the response to that requirement. So, for instance, when some of us first started working in the homeless services, it was really kind of a free for all, and people, in order to gain access to services, maybe you had to be super savvy if you were experiencing homelessness about like advocating for yourself or knowing which agency to go to and which rules each agency applied in order to get into services. Or maybe you just got the luck of the draw, right? And you found an agency that had really great, like equitable services and was willing to advocate for you. But that might depend on like case manager to case manager or agency to agency. So this requirement is a regional stop where people go or referred to when they're experiencing homelessness, and um, and we have a regional set of criteria, right? Each person gets their own assessment, and it's a standardized assessment across each CAN, and then they have the same referral criteria for each type of housing intervention: permanent supportive housing, PSH, rapid rehousing, and those types of things. So it really organized our system and made it a way more equitable process, less dependent on the various factors that I was talking about. So it shows what CANs do. They know which programs exist. This graphic shows you what CANs do, which programs exist in the area, what each program provides, the criteria for getting into each program, like who they serve, if they serve veterans, if they serve only men, if they serve youth, and where there are vacancies, ensuring people who need help know how to call 211. They help as many people as possible to tap all available resources to avoid going to shelter or being on the streets. They keep a by name list of all of the people who come to them who need help, and that prioritize those who have been homeless the longest and who have the most intensive service needs. And they work together to find creative solutions to get and keep people with tons of barriers housed. So another core component, as I talked about already, is the homeless management information system. HUD requires continuous care. HUD requires programs in the continuum of care and programs that get funding from the Emergency Shelter Grant or ESG funding to participate in the Homeless Management Information System or HMIS system. That became a requirement in 2004. Again, so prior to that, there was no comprehensive system. People kind of got together, put their heads together, and were like, what do you think our numbers were last year, and what sounds good, and what do our funders want to hear? And now we have this database where all of the information, all of the data is put into the system so we can see exactly who we're serving, exactly for what time period, and then the outcomes of those services, right? So our HMIS is a statewide database. Providers collect and enter data. Data uses include service coordination, system performance measures, which is an annual report of who we're serving, how the number of people we're serving, and then the outcomes that we're required to submit to HUD every year. The point in time count, which I mentioned already, and along with that goes the housing inventory count, which is looks at all of the beds and units we have in our system that are designated to serve people who have had homelessness in their history. So look at kind of the resources we have and then the people who need those resources and submit that to HUD. It's used for each individual program to submit an annual performance report or an APR. We use HMIS to look at within our system. It's an internal process for each program and their outcomes in the renewal evaluation process. And Advancing Connecticut Together at this point in time is our HMIS lead for CT BOS, and Nutmeg houses our HMIS system. For more information on HMIS, there's a link here at the bottom of the slide. Core components, here's when we get to the project types, right? So all that big pie that we saw earlier, what actually is in that pie? Permanent supportive housing, as I said, is targeted to people who are homeless the longest with the most intensive service needs. It's required to have a disabling condition to enter permanent supportive housing, and it pairs housing with supportive services in order to keep people housed, in order to maintain housing. That intervention is not time limited. Rapid rehousing provides quick access to housing through rental assistance and supportive services. Those are still coupled. People in rapid rehousing are reevaluated regularly to look at whether they still need the resource or whether they don't anymore and can move on to permanent housing on their own. In our COC, that resource is limited to 12 months and exceptions are possible, but not beyond 24 months. Transitional housing is also temporary supportive housing, which serves as a bridge between homelessness and permanent housing. The goal is to be in that intervention, transitional housing, for less than 12 months. Then we have coordinated entry programs, and those in our COC support the CAN. So it's to support each backbone agency in our CANs. We have grants for homeless management information system, which we talked about already. And then we have COC planning grant, which supports COC operations, running meetings, creating policies and procedures and trainings and that type of a thing. Any questions on any of those project types? Okay. So we at CT Boss Continuum of Care have some YHDP or youth housing demonstration projects. In 2016, for the first time, this funding became available, and CT Boss competed with continuums across the country and was one of 10 communities nationally selected in the first round of YHDP projects. Those projects then started late in 2018, and they provide the services listed here: crisis housing, diversion, rapid exit. Those are both short-term interventions for youth aged 18 to 24. Youth navigators that help the CAN do intakes and provide light case management to help people move into housing as quickly as possible. And then we have YHDP rapid rehousing specifically towards youth. The Connecticut Department of Housing is the YHDP lead. And for more info on that, there's a link here for you all. We have DV specific, domestic violence specific funding also. That's a separate pot of money that HUD sets aside every year for survivors of domestic violence. Bonus funds have also recently been, I'm sorry, so that, I don't know, that's been available for the last 7 or so years. It didn't come at the very beginning, but it came maybe after 2010, right? So domestic violence rapid rehousing projects is the main thing that we fund with our DV bonus money. That provides rental assistance and housing coordination to survivors, as I said, individuals and families, and it's administered through Connecticut Coalition Against Domestic Violence, CCADV. I think we have a slide on them coming up. The services for those rapid rehousing projects are provided by 19 CCADV member organizations throughout the state. Rapid rehousing, joint transitional housing. So this is a new type of program funded specifically for survivors of domestic violence to help them move even more quickly into transitional housing and then eventually into a permanent housing component and self-sufficiency. We also with DV, they also have some money for coordinated entry at this point in time. Prevention and diversion. So these are interventions that we're mostly funded by other non-continuum of care funding, although now prevention, like if you think of street outreach as a form of diversion, which I guess it's not, people are already experiencing homelessness at this time, right? So yeah, this is funded by money that is not continuum of care funding, but is still an important part of our system. So this occurs at the CAN level and through 211. It prevents homelessness at the beginning. So if people call and they're at risk of becoming homelessness, the system can help them find interventions to either services through another program to assist them, or provide some really light touch case management, or connect them with a funding source that might be able to keep them housed, right? They help identify immediate housing arrangements, may provide a bit of mediation, connect people with services, financial assistance. For more information, there's a link on shelter and diversion information. Outreach focuses on people who are living unsheltered and engages people into services, providing housing navigation, and again, some case management, right? Projects. We used to have only PATH money, projects for assistance in transition from homelessness, which was SAMHSA money to serve people who are unsheltered. But a few years ago, 2022, there was a special NOFO, supplemental notice of funding opportunity um, to provide that we our continuum of care got money from to provide new outreach services in all 6 of our cans. So we were very fortunate to get that money. Some communities also have outreach teams in addition to PATH and SNOFO money. There might be religious organizations or other types of organizations that provide outreach. The Connecticut Department of Housing received coronavirus stimulus funds, and we did use that at one time to do additional outreach throughout the state. There, right now, we have a whole new street outreach page on our website, and there are lots of trainings and good resources about outreach services on that page. Next, emergency shelter. Ideally, people stay in shelter for only a brief period of time and are helped quickly to find another, more permanent, stable place to stay. Um, Shelters serve to meet basic needs: shelter, food, safety, and hygiene. Some offer a level of support of case management to help people gain more resources, obtain housing. Some do not. Our emergency shelters in Connecticut are funded primarily by HUD ESG funding, and that comes through the Connecticut Department of Housing and some other private sources. Again, there are some religious organizations or other organizations. Ramon is asking, where can I find the link for the diversion programs? Is that there is a link to 211?
Yeah, let me look, and if I can find it, I will put it in the chat, and if I can't, I will send it out by email. But yes, we'll take a look.
Thanks, Liz. All right, hubs. This is a new resource that we have in CT BOS. So there are 14 hubs throughout the state. Their goal is to prevent homelessness through providing crisis resolution and connecting families and individuals to all of those housing components that we just said. They also can provide a security deposit or assistance with funding security deposits. There's a few areas that they provide services in. Drop in basic needs, so a place to stay where it's warm and you can access laundry facilities, showers, clothing, meals, and help to get emergency shelter placement. They have on-site counselors and offer needs assessments for people, service planning, and referrals to social services. Many hubs include partnerships for mental health care, substance use recovery, and medical services. And then some hubs also can help with employment and help gaining income, right? Key partners. So before I move on to key partners, any questions on the components that we talked about? No. All right, moving on. So there are many different people and organizations that play critical roles in ending homelessness. We appreciate all of our partners. We're not going to try to list them all today, but we're going to walk through a few of them here and focus on the ones that are most directly involved in the COC. HUD, right? The Department of Housing and Urban Development. The HUD Office of Special Needs and Assistance Programs, which we refer to as SNAPS, oversees the COC funding, right? So they create the rules and scoring criteria for our annual competition, NOFO, and they score applications for that. They develop regulations, notices, federal policies governing continuum of care projects. They gather feedback from all of us providers. They do some trainings and organizing, and they provide guidance to the field offices and to grantees. HUD Hartford field office is our local our local HUD representative, right? So the phone number is here. They issue our contracts, process grant amendments, monitor grants, and provide guidance to grantees. So if we have specific issues specific to our grants, need to tweak something here or there, have trouble getting a contract, um, the Hartford field office is who we reach out to for help. Key partner state of Connecticut. Mm, one of the state-run organizations is our Department of Mental Health and Addiction Services. We call DEMAS. They are our COC's collaborative applicant. Another slide is going to look at what that collaborative applicant title means, but they are like when we submit the NOFO, it's DEMAS that submits our application. They contract with and oversee us as consultants to the COC, Housing Innovations, and they contract with ACT as the HMIS lead. They are the main permanent supportive housing grantee. We do have a few other PSH grantees, but they're the main one. And then in their really big grants, they have several subrecipients under them receiving funding. They provide services for PSH, which can be used, some of it which is used for match for our permanent supportive housing programs. They provide behavioral health services throughout the state through the local mental health centers, local mental health authorities, LMHAs. They administer PATH and COC funded outreach. And Alice Minervino is our COC steering committee chair who represents DMS.
Melissa's asking, is there only one HUD field office in CT? Yes. Did you just answer that?
Yes,
Sorry.
there is. In fact, I feel like they reduced them nationwide recently, but
Yeah.
CT is one of them that survived. Yeah.
Yeah.
State of Connecticut Department of Housing is also another important key partner. They are our rapid rehousing grantee. And again, they're really large grants, and then they have regional subrecipients throughout the state. They are also our, as I mentioned earlier, our YHDP or Youth Continuum of Care Funding lead. They oversee the CANs and they fund 211. They also administer Emergency Shelter Grant, ESG funding, which provides most of our shelter funding. They provide moving on vouchers and other affordable housing. So they have designated vouchers and affordable housing that are assigned or set aside for people who have experienced homelessness that allow our people to move out of our programs and into those other programs when there's less of a service need for individuals. They also administer Unite CT funding, rental assistance programs, and additional outreach funding. Steve DeLella of the Department of Housing is one of our Continuum of Care Steering Committee chairs. CCH, Connecticut Coalition to End Homelessness, is another key partner. They lead the CT Can End Homelessness campaign, which if you go to their website, they do many wonderful things. They do a lot of advocacy on the state level for funding for our homeless programs. They pull together various parts of service providers or different people who have interest stakeholders in the homeless system, and they do a lot of really good work related to getting positive exits out of our system or organizing to get like prevention services and that kind of a thing. They hold trainings, they conduct research, analysis, and advocacy on many issues. They run shelter diversion programs, and they also run a few YHDP programs. The Data Strategy Board is a newer component of our system. So they play an important role in the COC, and we rely on them to oversee many tasks related to HMIS. Um, they approve HMIS policies, user agreements, establish the minimum data elements to be collected by all HMIS participating programs. They advise ACT and the steering committee on all things to do with HMIS. They help us establish data quality benchmarks. They review and prioritize requests for system improvements. Russ, anything to add on the data strategy board?
I'll just say it's been, I think the reformation of the steering committee and, the kind of realigning it with current technology and, current what's really happening on the field was a great addition. I think about a year ago when they kind of reconstituted it. So I think we've got the right pieces in place to move the whole system forward.
Yeah, great. Thank you so much. Appreciate that. All right, key partners, ACT. Um, ACT recently became our HMIS lead and took over that position from CCEH. So ACT is an umbrella agency that encompasses three different areas: AIDS Connecticut, Connecticut Association for Human Services, and they do some reduction of harm work also. They provide a broad range of services to ensure people impacted by HIV and AIDS have access to the supports that they need. They contract and oversee Nutmeg. There's a link here to the HMIS help desk. There's links on cthmis.org, .com.
It's yeah, cthmis.com.
cthmis.com has all things related to HMIS in our region. They lead the LSA, system performance measures. Those are annual reports that we have to submit to HUD. ACT is also the rent administrator. So for rapid rehousing programs, people who, all of the people in there who need rent assistance, those requests and the funds go through ACT. And John Mers from ACT is their representative on our CT BOS steering committee. He's one of the chairs. CCADV, I talked about Connecticut Coalition Against Domestic Violence a little while ago, was the recipient of our DV bonus funds. CCADV advocates to strengthen state and federal laws and gives trainings throughout the state to help about help available for survivors and some other trainings about safety and that type of thing. They coordinate 18 member organizations throughout the state to provide services and to provide housing for survivors. And they're the rent administrator for the DVRRH programs. Now, I think I'm going to hand it over to Liz.
Yes, we're still talking about our key partners because we have so many great folks and we can't even name all of them. So we have, see, once again, this is called CLIP, Community Leadership Involvement Project. So we'll have to write that out and put a note. And the goal of CLIP is to bring more voices to the process. CCEH, the Connecticut Coalition to End Homelessness, is in charge of this project. And so they train and support folks with lived experience who then are consultants and can help bring their knowledge and expertise to the steering committee. And new this year, CLIP members are the community reps to the steering committee. So that's a new component. CLIP has been fantastic. They've been invaluable in providing information to us on helping out with the scoring committee, grievance committee. They've commented and provided a lot of feedback on our policies, and it's been a great, really great partnership, and we're lucky to have them. Partnership for Strong Communities. They have been our friends and been around for a really long time, and they focus on ensuring folks have access to affordable housing. They do a lot of work in the housing policy world. They coordinate advocacy, they advance research, and they bring folks together. And it says here, their vision is for everyone to have safe, stable home that's affordable to them in community of their choice. And we have them on our steering committee as well. So we're listed here, housing innovations. So Shannon and I work for Housing Innovations along with a host of other really great people. Our contact information will be at the end of the training. So as we were saying from the beginning, one of our biggest thing and really what Shannon and I primarily work on is staffing the continuum of care. We also provide COC trainings and technical assistance. We work on the HUD COC application, or you'll hear us calling it the NOFO. Shannon and I both evaluate projects. We evaluate renewals. Shannon is our webmaster, so we have a CT BOS website, and we work really closely with our friends at ACT and Nutmeg on SPM, system performance measures, and HIC-PIT projects. Governance. All right, let's see how this is done. So we have links here, so you're welcome to check out our governance charter and bylaws. And what that does is just show how do we function? How are decisions made? What are the roles and responsibilities of members and committees? And it goes into the mission, vision, and purpose of the COC and the operations of the COC. How should we be functioning? Okay. So we'll tell you a little bit about who is on the steering committee. So as I just mentioned, community representatives are also the CLIP members, and I think we generally have 8. We have 1 vacancy, but I won't list everybody's names throughout. You can see who's here. Luckily, we have a few of you on the call today, so thank you for joining us. And as I mentioned, community reps serve on the grievance committee. They serve on the scoring committee. They have provided, as I mentioned, feedback to surveys and policies and have been super helpful with all their great work. Again, I won't list all of these, and I hope I didn't miss anyone because we've added some new folks. But this is the list of government, not-for-profit agencies, and then some other reps that we've brought on. We are missing law enforcement as I'm looking at this, so we'll make sure that's added. So all of these folks are part of the steering committee. What they do is nominate. So the agencies nominate someone. We'll actually talk about this in a bit. And then other folks come up every year. Some of this was in response to HUD saying, hey, why don't everyone really should have certain people on their steering committee. So we added elected officials, law enforcement, and a business representative. So those are the new folks. Other folks have been on in the past, and we'll talk a little bit about it in the next slides. So in addition to all the folks I mentioned, so we talked about the community reps, we talked about government, not-for-profits, and then other kind of select areas. We also have 2 people from every coordinated access network. So again, I won't read everyone, but these are the folks who represent their CANs. They're super helpful too because what we do, our policy in balance of state continuum of care at a steering committee, when a new policy or idea is brought forth, we talk about it 1 month and then we vote on it the next month. There are exceptions when we need to get something done very quickly. But in general, we want to let everybody have a month to percolate, think about it, and then come back and vote at the next meeting. And what's really helpful about our CAN folks is they have CAN meetings sometime during that month. So they're able to bring back any questions, comments, concerns from the CAN as we create new activities, policies, tasks. They get to let us know what's happening with the CAN. So that's really helpful. Okay. So what do steering committee members need to do? Well, our hope is that you attend as many meetings as you can because we only meet once a month and we meet live once a year, generally in November. All the other meetings are Zoom, generally the third Friday, unless we hit a holiday, from 11 to 12:30. So that's really, really our hope is that the steering committee member or alternate is able to attend those meetings and then feel like you can bring your voice to the meeting in whatever informed way you can. We'd love for you to participate in now, it doesn't mean point in time count that you're necessarily hands-on on all of these, but that when we come to you, you're able to provide feedback and counsel on the point in time count, HMIS, different strategic planning, advocacy efforts, system reviews, and then you'll hear us talking about the NOFA a lot, the application for the COC funds that we request from HUD every year. Together, we establish policies. So if something is going to change in terms of governance or operations, that's the steering committee. So you're going to vote on that. We ask folks to just provide information to us when you see a gap, when you know what's going on. That's part of the steering committee's job. We ask for direction to help Shannon and I do our work. And then we ask folks to follow all the laws we just talked about, as well as the code of conduct. And I'll just, so as we talk about code of conduct, we mean that we want to have the highest standards possible for making really good decisions, having really professional behavior, and embracing equity and inclusion for all the stakeholders who are there. And I'm just going to give an example because folks often ask, what would be a conflict of interest? So a conflict of interest might be if Shannon's mother owns a building and she's on the steering committee and she wants her mother's building to be a place where folks are going to use rental assistance, or her mother's going to apply for COC funds. Even though we know that Shannon wouldn't do anything that she shouldn't do, it's, as you hear people say, the perception, right? It's the perception of a conflict of interest. So we just ask it. It's not a big deal. Doesn't mean you can't serve on the steering committee. It just means that you would recuse yourself. So that's like one kind of unique example. What comes up much more frequently is someone who's a CAN representative might be, or we may be doing a vote on COC funding. Like, are we going to, do we want to fund permanent supportive housing this year? Do we want to fund rapid rehousing? And what we do is ask only our non-conflicted members to vote on that. So again, it's not a slap in the face. It's not a critique of anyone. It's just that we don't want any members voting who get funding, which is most of our members, which why it makes really important that we have non-conflicted members who can vote. You may have a conflict. Maybe someone once upon a time got services at Columbus House and feels like, ooh, I have a conflict. And then you just abstain. So again, this doesn't rule anyone out from serving on the steering committee. It's just we ask you to identify your conflict of interests, and we do ask you to fill out a form every year. And if you're not sure or have a question, you can ask us. Sometimes we will say this is only for non-conflicted folks, and then we'll list out who the non-conflicted folks are to make really clear who can vote on something. Because we just want it to be fair and equitable and everyone to feel good about whatever decisions we're making. Okay. So I'll go really quickly because I know our time we're moving along. But our core principles and goals are really just, like I said, that we can work together, that we can ensure diversity, equity, and inclusion. We want folks to feel really good at a steering committee meeting and that everybody's ideas are valued and respected. We've been talking about conflict of interest, just that folks identify that. And that if you have a question and you think something is not going quite right, that you say something, whether you're a steering committee member or you're a participant in the steering committee meeting. We're really asking folks, and we have a slide on it on Friday, if something doesn't feel quite right, whether it's a conflict of interest, whether it's language we're using, whether it's how something's happening, we really want folks to feel good in the meetings, feel like they're productive and equitable for everyone. So please let us know if you ever have a concern. I'm not going to go through each of these because I talked about the conflict of interest, but you can take a look at what it is. And as I mentioned, you're required to submit a conflict of interest if you're on the steering committee form annually, just so we have that. You can read through this on your own. Again, if you're not sure, just ask us. if you have a concern. And there's never a problem with people abstaining, and you don't need to tell us why you're abstaining. Some folks decide, oh, I just don't know enough about that, and this feels like I don't want to weigh in. As a steering committee member, you are more than welcome always to do that. I talked a little bit about this before, but how do you get on the steering committee? So, as we discussed, the community reps, the 8 community reps, are actually CLIP members. So, CCH chooses the CLIP members, and then they become our community reps. Can select their folks, and so they have 2. They have, and so the cans get I'm in the weeds a little. Cans get 2 votes. So, either one person can vote and it counts twice, or both folks can vote. Agencies appoint their steering committee reps, and then elected officials, um, the education sector, business community, and public health reps are nominated and elected every year. The co-chairs each serve 2 years, and every year 2 of them are up. And currently, these we have Alice, Steve, John, and Stephanie are fantastic co-chairs. As I mentioned, we have our meetings the third Friday from 11 to 12:30. We love to have steering committee members and everyone else. It's open to everyone. The meetings are open to all. As I mentioned, they're on Zoom for 11 of the 12 months a year. And then generally in November, we all meet live. There is a link to check out CT BOS homepage. So if you're not getting emails and you want to get emails, we ask folks to sign up on their own so that you can choose which emails you want to get. So steering committee, are you a grantee? Do you want all of them? You get to check that, and then you will receive our materials. All right, we're going to talk a little bit about systems and performance, project performance.
Oh, sorry.
Oh, good. So as Shannon mentioned early on, one of the things that we are required to do, so it's a HUD requirement. So HUD says you're in charge of looking at all the projects. I think Shannon said 114, and then there's some sub-projects under that. You're required to take a look at these projects and let us and decide, are they working? They're not working. We get to decide in some respects what we evaluate, and then sometimes HUD basically tells us what we have to evaluate. So we look at spending, we look at every year we have consumer or participant surveys, and then we call it performance. How are things going? Are our clients, our participants increasing their income? Are they going to positive exits like permanent housing and other places? If folks don't do well and we decide each year, I shouldn't say don't do well, generally it's the bottom scoring 10% of projects. Those folks are asked to submit a corrective action plan. And we do let folks know that if you are in corrective action for many years, you risk losing funding. I will say, though, this does not happen frequently. And before anyone loses funding, we get very involved and provide technical assistance. It is always our goal to have all our funding continued because folks are providing very critical housing and services to folks. So we put that out there, but in general, we are not taking funding from folks. And then the way folks are scored in the renewal evaluation process helps us determine the order that they are ranked in the HUD competition. Okay,
Did it move? No.
there we go. Shannon talked a little bit about this, the housing inventory count and the PIT point in time count. So we're required annually. So again, not that it's not a good idea, but we are required by HUD to do this. So every year there's a count of all persons experience homelessness on a single day. And this happened at the end of January already in 2026. And then for the housing inventory chart, we look at all the shelter beds, all transitional housing, rapid rehousing, permanent supportive housing for people experiencing homelessness. And we do a lot of data entry. We work super closely with our great friends at Nutmeg, who pull all of this together and project manage what's a very, very big process every year. And then look out for probably late spring, early summer. We will ask our Nutmeg to come and present the results. So you'll get to see the 2026 results in a couple months. So this is hard, a little tiny bit hard to read, and I won't go through every bit of it, but you can take a look at what unsheltered and sheltered homelessness has looked like through the years. We are higher than we have been in the last few years, unfortunately. You can see maybe a lower dip from in sheltered from 2018. And unfortunately, too, unsheltered homelessness has been on the rise since 2022. Shannon,
It's
anything
looking
to
like
say?
it
Yeah, I was
might,
just going to
it's looking
say.
like it might, unsheltered in particular, might be lower this year. It was
Oh,
particularly high last year, but it was like the emergency, what is that emergency situation? Cold weather.
oh,
So
correct. Right. It was code blue in the state, which means that really folks have to do anything we can to get folks inside. Not that we're not generally working on that, but it's so cold, it's just dangerous to be literally lethal to be outside. So you're right. That so it may be a little bit lower this year because we chock full all the resources that we
yeah,
have.
right.
Yeah. So Shannon mentioned this a little bit too. So you'll hear us talking about system performance measures. So this, and again, a good idea, HUD also requires it. So we are required to look at how is the entire system doing. So not just how is one project doing and is that one project getting employment, but if we look at our whole system, and I won't read each of these, but you can see these 6 different measures. How are we doing? Are we moving people into housing? Are we stabilizing folks? How are we doing at reducing the number of people? Are folks getting connected to jobs and benefits? What about new folks coming into the system? Are we preventing people from even entering at all? And how are we doing when folks are leaving? Are they going to permanent housing? So we also will have, I believe, I will just say spring, our friends at Nutmeg will present system performance measures. So you'll get a chance to look at this. And what generally they do is show us what last year looked like and what this year looks like and how we did, hopefully, to improve each of these measures. So, why do we do this? And not just because HUD told us we have to. We use these data to evaluate performance. So we look at system performance measures, we look at Hick and Pitt, and we say, what can we do to provide the highest quality services and housing to all of our folks? So we know that system performance measures impact our ability and HICPIT impact our ability to get funding from HUD. So HUD looks every year and says, how many folks do you have? How much housing do you have? How are your system performance measures? Are they getting better? And then you are scored on that when we submit our, you'll hear us talk about our NOFO, when we submit our NOFO to HUD. So it's really important for funding. And it really impacts our renewal funding. Um, as I mentioned, we're always looking at these things to figure out how we can just make the system more effective, how we can have fewer homeless folks, how we can provide better housing and services, what interventions are needed, and who needs them. And then, as I mentioned before, sometimes we're looking, are we going to fund rapid rehousing? Are we funding more permanent supportive housing? We look at all the data that we have, and the Hick and Pitt and SBMs help us to decide what we're going to fund. And then again, how as a system can we come together and coordinate everyone together to fill the gaps. So I'm not going to, Shannon's smiling because this has all been controversial. Those of you who've been to meetings know there has HUD released in December a 2025 NOFO, which means they started a competition. And I'm just going to only give a few sentences on this. It has been retracted. There have been multiple lawsuits. There's a lot going on right now, and it's still up in the air, which we have in the next slide. But just so that you know, in a normal year, which that may be a thing of the past, there may never be a normal year again. But HUD awards about $4 billion. What's important here to know, this hasn't changed, is that there, as Shannon mentioned, there are continuum of cares all over the country. So we have two in Connecticut because we've really consolidated, but Florida has 30 and Pennsylvania has 20 or 30. We compete with all the COCs all over the country for this pot of money. So it's highly competitive. And then there are three parts of the application that we submit. We submit an application from the COC. So Housing Innovations pulls this together. And as I just mentioned, so we put in the results from the Hick and Pit. We put in the results from system performance measures. We tell HUD how we are doing, and then we are scored by HUD on that. And then also Housing Innovation coordinates the project applications. So this is a lot of work for providers, and we are so grateful we have the best providers, and folks work really hard. We pull together the applications together and they're submitted electronically, and then we are required to rank the projects.
I just wanted to add one note on
Please.
the NOFO, the COC competition. It used to be that most of the NOFO was a lot of questions that the COC would respond to, right? So you could tell your plan, tell your story about what you have been doing about a particular issue, and then what your plans were to do about a particular issue. And that is still part of it, but increasingly since maybe 2015 or so, they have been scoring continuous care on the data, on the numbers themselves, so on those system performance measures, and it's an increasing percentage of the score every year. And I feel like with this administration, we're still trending that way, and their score, like the most recent NOFO again, which is controversial, but like it gave it even more weight to those numbers. Like you have to have shown an increase of 25% in the people who gained income. For instance, I'm making that up, but it was a greater percentage, relying on a greater increase in certain metrics in order to get full points on the NOFO, which full points, more points, the more funding is available to you.
And just we went to very high level. There has been a real shifting of priorities with the new administration. And so in the 2025 NOFO, which, as I mentioned, it's not currently in effect because there are lawsuits going on, and they may just time out and have to fund the renewals, and then we'll have a 2026 NOFO. So there's a lot going on, but I just wanted to highlight some of the priorities that HUD let us know, things that are important to them. So they're really focused on treatment and recovery. Um, they want services to be mandatory in programs so that folks don't have a choice, but that they need to be engaged in those services. There are work requirements, for example, in transitional housing projects. And then we're reading a lot and seeing a lot on their focus on public safety. So they are looking at laws prohibiting camping, illicit drug use, enforcing enforcement protocols, and cooperation with law enforcement. And a huge, it can't be understated, it's just a bullet, but they're really limiting funding for permanent housing, which is a real issue for our COC and many COCs because that is the vast majority of our funding. I didn't go into detail the percentages and tracking. There's a lot going on. We actually will talk more about it at the steering committee meeting on Friday. But the big takeaway is it's a real issue with limiting the funding that they have for PSH. So we just have some links if you want to learn more. Check out these trainings. You know what I also realized I did not put in? I will put in the learning management system link. So you'll have that also. But there are tons of trainings. If you go to our CT Boss website and go to the trainings page, we have a lot of other people's trainings. We're always I think we do a great job in our COC. Everyone's promoting each other's trainings. So please check those out. And if you see any trainings that you think are fantastic and we should be promoting them, please let us know and we'll add them to our website. This is our team at Housing Innovations, so feel free to reach out to any of us. We're always glad to talk about the COC or anything you guys want to talk to. And we feel so lucky. We have fantastic partners. These are trying, tough times, but folks are working really lovely together and supporting each other through what's not an easy time for anybody. Um, but we have a few minutes left. Are there questions?
So I'm gonna do you mind stopping the recording and I'll stop the share?
Yes.
Yeah, okay.